Class, today I'm going to be discussing type 1 diabetes. In this case study, Jane Doe is a 7-year-old girl that was taken to the ED with abdominal pains for the last 48 hours. Her pain was not relieved by taking pain medication, and her mom states that she had vomited several times. Also, the mom states that she has recently started wetting the bed again at night. Review of the other systems are unremarkable except that the patient has lost weight recently, but the mother attributes that to starting school again after having had the summer off. Type 1 diabetes is an autoimmune disorder that requires insulin and affects 1.3 million Americans. Onset can occur at any age. Up to 50% occur in adolescence. Two types of type 1 diabetes, type 1 immune-mediated, which occurs in 90 to 95% of type 1, and this is formally called juvenile diabetes. Type 1B is not as common and usually occurs in African or Asian descent. Type 1 diabetes pathophysiology, patients have a predisposition to diabetic genes, and usually an event triggers the immune response, such as an infection. Epidemiology of diabetes in the U.S. in 2014 to 2015, more than 18,000 people under age 20 were newly diagnosed with type 1 diabetes. The annual rate for new cases is about 21 in 100,000. Some differential diagnoses that we can make for Jane, the nighttime bedwetting could be explained by stress or other life changes, especially things like bullying. Weight loss can be attributed to increased activity or stress, and as well as bullying. Diagnosis would be an 2 A1C levels of greater than 6.5. Also, you can do random blood sugar tests, which are done throughout the day, fasting or non-fasting, and also a fasting blood sugar test of greater than 126, and you'll need 2 of those as well. So there's different delivery systems for insulin. You can do a pump, which can have a basal rate or be given bolus before meals. Delivery can be in upper arms, abdomen, or thighs. The newest on the market is the pre-dosed insulin needles, as well as the Lantus needles. The primary action of insulin, including insulin glargine, is regulation of glucose metabolism. Insulin and its analogs lower blood glucose levels by stimulating peripheral glucose uptake, especially by skeletal muscle and fat. And obviously, contraindications for insulin would be hypoglycemia, which is why you should tell the patients to test their insulin. So, discussing testing your insulin, patient education would include teaching the family and the school, since this is a 7-year-old child, to check the glucose 4 times a day before meals and at bedtime, and then check as needed when the patient is feeling ill. If they report signs of hypo or hyperglycemia, they should be checked as well. Um, for the child to go to school, they should have an area for the student or the staff member to test. In the desk, they should keep their test kits as well as snacks for hypoglycemia and be allowed to eat them when that's present. The patient should follow up with their primary, keep a log of sugars and diet, so obviously that will be the mom doing that. The patient should also be referred to a nutritionist that will help not only the patient but the family get on the right track of what to eat and what not to eat, as well as a diabetic support group that could really help, especially the mom, in how to help and treat her daughter. So in conclusion, education is really important for these families. This is not just a small change. This is going to be a major life change for them. They're going to need to change their diet as well as the entire family diet, really. The patient and the family will have to learn how to test, and as well as how to use their medication. Thank you.